Most people think swollen legs are a heart problem, or a kidney problem, or just old age catching up. I'm going to tell you something that took me years of working with patients to fully appreciate. In the majority of cases I see, the swelling in your ankles and feet has nothing to do with any of those things. It has to do with stillness. And the fix, when caught early, is simpler than anything your doctor has probably prescribed. My name is Hameed Ullah Shaheen, and as a vascular surgeon, I spend a lot of time looking at legs, healthy ones, struggling ones, and everything in between. And after thousands of patient visits, one pattern stands out above everything else. The people who age gracefully, who stay mobile, independent, and comfortable well into their 70 seconds and 80 seconds, aren't necessarily the ones with the best genetics or the most medication. They're the ones who kept their legs working daily, consistently, even in small ways.
Today I want to show you what that actually looks like. 5 movements that take less than 10 minutes total, require no equipment, and directly address the root cause of why fluid pools in your lower legs as you get older. But first, I need to explain something most health videos skip entirely. Your heart pumps blood down to your legs easily. Gravity helps. The problem is getting it back up. For that return journey, your body relies on something called the venous pump, a system of valves inside your veins and the muscles surrounding them that squeeze blood upward with every movement you make. Walk across the room? Pump. Stand up from a chair? Pump. Even shift your weight? Pump. But here's what happens as we age, especially if we're spending more time sitting. That pump gets rusty. The muscles weaken slightly, the valves lose some efficiency, and fluid, which should be moving, starts settling. You feel it as heaviness by afternoon. Sock marks, puffy ankles, shoes that fit fine in the morning but feel tight by dinner. And if nothing changes, it progresses. The fluid that keeps settling starts affecting skin, then tissue, then your confidence in your own balance. People start taking shorter walks, then no walks, and the pump gets even weaker. This is the cycle I want to help you break today. Movement 1. Forget heel raises for a second. I want you to try something slightly different, one that activates your calf pump with intention. Sit near the edge of a firm chair. Place both feet flat. Now press the ball of one foot firmly into the floor, like you're trying to leave an imprint, and hold that contraction for 5 full seconds. Release slowly. Switch feet. That sustained squeeze is more effective than a quick raise because it mimics the sustained pressure your calf generates during walking. 10 repetitions per foot. Do this every hour you're seated. You'll feel the difference within a week. Standard ankle circles are good, but here's an upgrade. Instead of a plain circle, trace a slow figure 8 with your toes, almost like you're drawing the infinity symbol in the air. This engages your ankle joint through more planes of motion, which means more vascular stimulation and better lymphatic drainage with every movement. 8 to 10 figure 8s per foot, twice a day, morning and evening. If your ankle clicks or feels stiff at first, that's normal. You're waking up a joint that hasn't been fully used in a while. This one targets a different system entirely, the lymphatic drainage that runs along the inner thigh. Sit upright. Place both hands on your inner thighs, just above the knee. Now press both knees outward against your hands as though you're trying to push your hands away. Hold for 5 seconds. Release. You're not moving far. You're creating gentle muscular tension in the upper leg, the region where many of the deeper drainage vessels run. This is the movement I give patients who can't do much else but still need their circulation stimulated. 10 reps, slow, intentional. Movement 4, pillow elevation reset. This isn't an exercise,
It's a strategy. Once a day, ideally after your most sedentary period, lie down and prop your legs so your feet sit above the level of your heart. A stack of 2 firm pillows works perfectly. You don't need a wall. Stay there for 8 minutes. Breathe normally. What you're doing is using gravity for you instead of against you. The fluid that accumulated over hours of sitting begins to drain passively back toward your core. Your ankles will feel noticeably lighter when you stand up. The key is consistency. 8 minutes every day beats 30 minutes once a week. Movement 5. Foot alphabet. Here's the one my patients always remember and actually stick with because it turns the exercise into a mental game. Lying in bed or sitting with your feet lifted slightly, use one foot to slowly write the letters of the alphabet in the air. Every letter engages a different combination of ankle muscles, tendons, and surrounding blood vessels. You don't have to do all 26 every time. A through M on one foot, N through Z on the other. Alternate daily. It takes about 3 minutes total. It's oddly satisfying, and it covers more range of motion than almost any other simple exercise I know. Here's what I want you to understand before you close this video. Leg swelling that you ignore at 62 is not the same problem at 70. The tissue changes, the skin changes, the mobility changes. And by the time it becomes impossible to ignore, the window for simple interventions like these has narrowed significantly. But right now, these 5 movements can genuinely change your trajectory. Not because they're miraculous, but because the problem, for most people, is simply a lack of consistent movement in the right places. Your legs want to work. They're built to work. They just need you to remind them how. Start with one movement today. Add another tomorrow. By the end of the week, you'll have a 10-minute daily routine that your future self will thank you for. If this was useful, leave a comment below. Tell me which movement you're starting with. I read every one. And if you have a friend or family member dealing with ankle swelling, share this with them. It might be the thing that changes how they feel every single evening.